This is a recently published case report comes to us from Wuhan, China by Zhong et al. In 2022, which proposed a new approach for the treatment of vertical root fracture of teeth. It's a case report with a follow-up of 1 year. The case consists of a 27-year-old Chinese woman who came in for a complaint of pustules on the labial surface over tooth number 9 in the anterior area. And upon examination, there was a deep isolated pocket on the palatal side of 8 to 10 millimeters of range. And upon CBCT inspection, there was a large area of radiolucency or area of low density in the palatal surface or palatal area on the palatal surface of the root. This was evident for the final diagnosis of vertical root fracture. And the proposed treatment was not extraction in this case, and was to keep the tooth and try to save it. And the treatment went through two arms. First arm was to do an intentional replantation, and the second arm is to do repair for this vertical root fracture. And before we go into the surgical part, they highlighted a schematic for the proposed treatment. And on the vertical fracture line, they would prepare a 1.5 millimeter wide preparation along with retention forms or dovetails on the coronal section and apical section of the root. The design of the retention forms was 3 millimeters wide outer surface and a 2 millimeter wide, inner surface, which would consist of the dovetail, and it is 2 millimeter in depth. And then they would use a sandwich of resin in the vertical line and or vertical fracture and the bioceramic eye root repair material approximately 1 millimeter thick on the outer surface, and that's to promote the periodontal attachment. So the case went through first the epicoectomy or the intentional replantation. The tooth was extracted, and the 3 millimeters of the apex was resected, and retrograde preparation and filling was done using bioceramic material. Then preparation of the fracture line and the proposed dovetail design, and then they would go in with a composite resin or any type of resin material that would bond to the tooth structure in the deeper portion, and the superficial 1 millimeter was prepared and filled with bioceramic materials, and the tooth was then replanted and splinted using ligation wire. The protocol for follow-up was scheduled at 1 month, 3 months, 6 months, and 1 year. And at the 1 month follow-up, the mobility of the tooth returned to normal range and the ligation wire was removed. Radiographic follow-up has followed with minimal changes, and at the 1 year follow-up, the tooth remains asymptomatic with normal gingival appearance, and periodontal probing depth and mobility were within normal, and the patient was satisfied with the treatment. These radiographs represent the follow-up periods. A is immediate postoperative, B is 1 month review, C is 3 month, and D is 6 month review. And the cone beam is in E and F, which shows all images at 6 month review, showing the bone reduction or the bone buildup and defect reduction. And also for the periodontal health, the probing returned to normal range. At the 1 year recall, the patient had no complaint of pain or sinus tract in the labial surface. The probing was within normal on the palatal surface, and radiographically there was minimal widening of the PDL compared to the adjacent teeth, and the patient was satisfied with no mobility or history of pain. This is a relatively unpopular approach for the treatment of this kind of defect. However, this might be utilized in cases where financial restraints or age restrictions that prohibit from doing restoration with implants.